Hello everybody, in this video I'm going to talk about enalapril. Enalapril is the third example of angiotensin converting enzyme inhibitors. First of all, I'm going to give a background about this drug and tell you what are the indications of this medicine. First of all, enalapril is a small molecule. It is composed of 20 atoms of carbon, 28 atoms of hydrogen, 2 atoms of nitrogen, and 5 atoms of oxygen. It's an ACE inhibitor, as I said. It is used for the management of essential or renovascular hypertension as monotherapy or in combination with other antihypertensive agents such as thiazide diuretics for an additive effect. It is indicated also for the treatment of symptomatic congestive heart failure, usually in combination with diuretics and digitalis. Furthermore, it is indicated for the management of asymptomatic left ventricular dysfunction in patients with an ejection fraction of less than or equal to 35% to decrease the rate of development of overt heart failure and the incidence of hospitalization for heart failure. The available doses of enalapril are 2.5, 5, 10, 20 mg. The maximum daily dose is 40 mg per day. Actually, there are many brand names of enalapril. One of these brands is Vasotec. It's um, oral pharmaceutical dosage form as tablets. Uh, and its doses, available doses in pharmaceutical market are 2.5, 5, 10, and 20 milligrams. Other brand for enalapril is enalapril. Here it's not oral pharmaceutical dosage form, so it's not tablets. Here it's a solution for injection, so the route of administration here is the intravenous route. Um, it is available in this concentration or dosage, which is 1.25 milligrams per milliliter, and if we double it we will have the 2.5 milligrams per 2 milliliters. Here we have Ipaned, which is a unique brand for enalapril. It's here an oral solution. It's not a solution for injection, of course. It's used orally, and its concentration is 1 milligram in each milliliter of this solution. Now we have this brand, which is Vasotec. Please don't combine between this drug and the Vasotec that I talked about, because as I said, Vasotec contains enalapril maleate, but here in this drug, in Vasotec, we have totally different active ingredients which are valsartan and hydrochlorothiazide. We have also 3 main doses of this drug. So I put this slide here, even though it's not related, and this brand actually doesn't contain enalapril, but I put it because we should differentiate between this drug and between Vasotec. We also have Inase in 3 main doses, which are 2.5, 5, and 10 milligrams, and it's enalapril maleate tablets, so it's used orally. The same oral form tablets in 3 main doses, which are 5, 10, and 20 mg, are within this brand, which is Impril. Delpas also is a common brand of enalapril. It contains enalapril maleate. Its pharmaceutical dosage form is tablets, so we can use it orally, and it contains 3 main doses, which are 2.5, 5, and 10 mg. Now about the mechanism of action of enalapril. The renin-angiotensin-aldosterone system, or RAAS, is a signaling pathway that works in synergism with the sympathetic system to regulate blood pressure and fluid and electrolyte hemostasis. Activation of this system after stimulation by different factors such as low blood pressure and nerve impulses leads to increased release of norepinephrine, or NE, from sympathetic nerve terminals and effects on the vascular growth, vasoconstriction, and salt retention in the kidneys. Renin acts on the precursor protein angiotensinogen, which is a plasma globulin synthesized from the liver to produce cleaved peptide hormone angiotensin 1. Angiotensin 1 then can be further cleaved by ACE, or angiotensin converting enzyme, to produce angiotensin 2, a vasoconstrictive peptide hormone. Present in different isoforms, angiotensin-converting enzyme, or ACE, is peptidyl dipeptidase enzyme expressed in various tissues, including the vascular tissues, such as the heart, brain, and kidneys. ACE also plays a role in inactivation of bradykinin, a potent vasodepressor peptide. Angiotensin II mediates various actions on the body by working on its G-protein coupled receptors, AT1 and AT2. It causes direct vasoconstriction of precapillary arterioles and postcapillary venules, inhibits the reuptake of Ne, thereby increasing available levels, stimulates the release of catecholamines from the adrenal medulla, reduces urinary excretion of sodium ions and water by promoting proximal tubular reabsorption, stimulates synthesis and release of aldosterone from the adrenal cortex, and stimulates hypertrophy of both vascular smooth muscle cells and cardiac myocytes. Enalapril is a pharmacologically inactive prodrug that requires hepatic biotransformation to form enalaprillate, its active metabolite, that works on the RAAS to inhibit ACE. Biotransformation is critical for the therapeutic actions of the drug, as enalapril itself is only a weak inhibitor of ACE. ACE inhibition results in reduced production and plasma levels of angiotensin II, increased plasma renin activity due to the loss of feedback inhibition by angiotensin II, and decreased aldosterone secretion. However, plasma aldosterone levels usually return to normal during long-term administration of enalapril. Decreased levels of angiotensin II subsequently leads to the dilation of peripheral vessels and reduced vascular resistance, which in turn lower blood pressure. While inhibition of ACE leading to suppression of RAAS is thought to be the primary mechanism of action of enalapril, the drug was shown to still exert antihypertensive effects on individuals with low renin hypertension. It's suggested that enalapril may mediate its pharmacological actions via other modes of action that are not fully understood. As ACE is structurally similar to kinase 1, which is a carboxypeptidase that degrades bradykinin, whether increased levels of bradykinin play a role in the therapeutic effects of enalapril remains to be elucidated. About the absorption of enalapril, following oral administration, the peak plasma concentrations, or Cmax, of enalapril is achieved within 1 hour post-dosing, while the Cmax of enalaprillate occurs at 3 to 4 hours post-dosing. The steady state is achieved by the fourth daily dose, and there is no accumulation with repeated dosing. However, accumulation of enalaprillate may occur in patients with creatinine clearance less than 30 milliliters per minute. Food intake is reported to have a minimal effect on drug absorption. Following oral administration, about 60% of enalapril was absorbed. Bioavailability of enalapril averaged about 40% when intravenous enalaprillate was used as a reference standard. About its volume of distribution, the volume of distribution of enalapril has not been established. Enalaprillate is shown to penetrate into most tissues, in particular the kidneys and vascular tissue, although penetration of the blood-brain barrier has not been demonstrated after administration at therapeutic doses. Now about protein binding property. It's reported that less than 50% of enalaprillate is bound to human plasma proteins based on limited data from binding studies of enalaprillate in human plasma, both by equilibrium dialysis and by ultrafiltration. Now, what's about the metabolism of enalapril? Actually, about 60% of the absorbed dose is extensively hydrolyzed to enalaprillate via deesterification mediated by hepatic esterases. In humans, metabolism beyond bioactivation to enalaprillate is not observed. Enalapril route of elimination. Enalapril is mainly eliminated through renal excretion, where approximately 94% of the total dose is excreted via urine or feces as either enalaprillate or unchanged parent compound. About 61% and 33% of the total dose can be recovered in the urine and feces respectively. In the urine, about 40% of the recovered dose is in the form of enalaprillate. About the half-life, the average terminal half-life of enalaprillate is 35 to 38 hours. The active half-life following multiple doses is 11 to 14 hours. The prolonged terminal half-life is due to the binding of enalaprillate to ACE. What's about the clearance of enalapril? Following oral administration in healthy male volunteers, the renal clearance was approximately 158 plus minus 47 milliliters per minute. It's reported that enalapril and enalaprillate are undetectable in the plasma by 4 hours post-dosing. Now I'll talk a little bit about the toxicity, adverse and side effects of enalapril. While there is limited data about enalapril overdose in humans, overdosage may result in marked hypotension and stupor based on the pharmacological properties of the drug. The most common adverse effects of enalapril include cough, hypotension, headache, dizziness, blurred vision, confusion, faintness or lightheadedness when getting up suddenly from a lying or sitting position, sweating, unusual tiredness or weakness. Now we have some warnings, precautions, and tips for patients. Food interactions. We should avoid hypertensive herbs such as bayberry, blue, kahosh, cayenne, ephedra, and licorice because they can lead to additive hypertensive effects. We should also avoid potassium-containing products because they increase the risk of hyperkalemia. And we can take enalapril with or without food because the absorption of this drug is unaffected by food. I talked about drug-food interactions and now I'll move to the drug-drug interactions. Using this medicine with any of the following medicines is not recommended. Your doctor may decide not to treat you with this medication or change some of the other medicines you take. These medicines include aliskiren and sacubitril. Here we have second category of drugs. Using this medicine with any of the following medicines, which is this, the second category, is usually not recommended, but may be required in some cases. If both medicines are prescribed together, your doctor may change the dose or how often you use one or both of the medicines. These medicines include allopurinol, alteplase, amiloride, aspirin, azathioprine, azilsartan, candesartan, camnewate, cyclosporin, eplerenone, eprosartan, everolimus, furosemide, interferon alpha, irbesartan, levoketoconazole, lithium, losartan, melphalan, mercaptopurine, methotrexate, olmesartan, oxypurinol, potassium citrate, potassium phosphate, sirolimus, spironolactone, tacrolimus, telmisartan, tinapaner, trimetrine, trimetoprene, and valsartan. Using this medicine with any of the non-steroidal anti-inflammatory drugs may cause an increased risk of certain side effects, but using both drugs may be the best treatment for you. If both medicines are prescribed together, your doctor may change the dose or how often you use one or both of the medicines. NSAIDs such as aceclofenac, celecoxib, eterocoxib, ibuprofen, indomethacin, ketoprofen, mefenamic acid, etc. Allergies. Tell your doctor if you have ever had any unusual or allergic reaction to this medicine or any other medicines. Also tell your healthcare professional if you have any other types of allergies such as to foods, dyes, preservatives, or animals. For non-prescription products, read the label or package ingredients carefully. Pediatric. Appropriate studies performed to date have not demonstrated pediatric-specific problems that would limit the usefulness of enalapril to treat hypertension in children 1 month to 16 years of age. However, use is not recommended in children younger than 1 month of age and in children with severe kidney disease. Geriatric. No information is available on the relationship of age to the effects of enalapril in geriatric patients. Elderly patients are more likely to have age-related kidney problems, which may require caution and an adjustment in the dose for patients receiving enalapril. Breastfeeding. There are no adequate studies in women for determining infant risk when using this medication during breastfeeding. Weigh the potential benefits against the potential risks before taking this medication while breastfeeding. Missed dose. If you miss a dose of this medicine, take it as soon as possible. However, if it's almost time for your next dose, skip the missed dose and go back to your regular dosing schedule. Don't double doses. Using this medicine while you are pregnant can harm your unborn baby. Use an effective form of birth control to keep from getting pregnant. If you think you have become pregnant while using the medicine, tell your doctor right away. This medicine may cause serious allergic reactions, including anaphylaxis. This can be life-threatening and requires immediate medical attention. Call your doctor right away if you have a rash, itching, hoarseness, trouble breathing, trouble swallowing, or any swelling of your hands, face, or mouth while you are using this medicine. Call your doctor right away if you have severe stomach pain with or without nausea or vomiting. This could be a symptom of a condition called intestinal angioedema. Check with your doctor if you become sick while taking this medicine, especially with severe or continuing nausea, vomiting, or diarrhea. These conditions may cause you to lose too much water or salt and may lead to low blood pressure. You can also lose water by sweating, so drink plenty of water during exercise or in hot weather. Check with your doctor if you have a fever, chills, or sore throat. These could be symptoms of an infection resulting from low white blood cells. Check with your doctor right away if you have pain or tenderness in the upper stomach, pale stools, dark urine, loss of appetite, nausea, vomiting, or yellow eyes or skin. These could be symptoms of a serious liver problem. Check with your doctor right away if you have blood urine, a decrease in frequency or amount of urine, an increase in blood pressure, increased thirst, loss of appetite, lower back or side pain, nausea, swelling of the face, fingers or lower legs, troubled breathing, unusual tiredness or weakness, vomiting, or weight gain. These could be symptoms of a serious kidney problem. Make sure any doctor or dentist who treats you knows that you are using this medicine. You may need to stop using this medicine several days before having surgery. Don't take other medicines unless they have been discussed with your doctor. This includes prescription or non-prescription or over-the-counter medicines for appetite control, asthma, colds, cough, high fever, or sinus problems, and herbal or vitamin supplements. Thank you all for watching. My next video is going to be about fosinopril. Please like and subscribe for more videos.